Hi, if you found this video, then you most likely know that you have a prolapse. And I just want to say I'm really sorry. I know that it can be scary to be diagnosed with a prolapse, especially if you're not sure what treatment options are out there for you. I want to reassure you in this video though and give you information that I think will make you feel empowered to know what you can do and what treatment options are out there. My name is Krista Norwick. I'm a pelvic physiotherapist, so I have a master's degree in physical therapy and extensive training in pelvic health, including prolapse. If you think you have a prolapse but you haven't been diagnosed yet, I definitely recommend your first step be to go see your doctor and ask them for any referrals that they think you might need. So sometimes you might get referred to a gynecologist or a urologist or a gastroenterologist. It depends on the type of prolapse. So you may need to go and get some referrals. I'm not sure though, so definitely go and see your doctor. The other person you can go see though is a pelvic physiotherapist, like me, who can help optimize your muscles in the function of supporting your organs. So let's dive into it. Why are your pelvic floor muscles involved in prolapse? So here is my pelvic model. I've got the pelvic floor muscles are in the whole of your pelvis here. This is the pubic bone. The back is your lower back, sacrum, tailbone. And your pelvic floor muscles are all these muscles here. Your pelvic organs are right here. So bladder right here, bowel, bowel's in here. I'm not going to line them up super properly. And if you have a uterus, it's in here too. So your muscles are one part of how your pelvic organs are supported. They help actively support them with muscle function. The other way that they're supported is, for example, here, I'll show you the bladder. Your bladder actually is attached to your pelvis via ligaments. So these are, would they be like a really stiff or tight elastic? So they attach and they're stiff. They aren't muscles. They can't move and contract. They're just in place, attached. And those two systems help to support your organs. And when you're coughing, sneezing, example, they work together to support your organs so that they don't feel like they're prolapsing, stretching down, bulging, that sort of thing. So if you're experiencing a prolapse, you might have changes in one or both of those systems. So your ligaments might not be holding and supporting as well as they used to, or your muscles might not be supporting from below as well as they used to. And with prolapse, I can't know for sure unless I worked with you in a one-on-one setting, but with prolapse, you might have one or both of those going on. The great news is that if we optimize the pelvic floor muscle function, that can make a huge improvement to your symptoms. The best way to optimize your pelvic floor muscle function is to work with a pelvic floor physiotherapist. So what we can do is we can teach you how to use your muscles. If you need to strengthen them, we can give you strengthening exercises. If you need to learn to relax them when you don't need to use them, we can teach you relaxation exercises. There's also a big component of coordination. So using your pelvic floor muscles when you need them. So you might have amazing strength, but every time you cough, your muscles aren't actually activating as well as they could. And so we need to teach them to activate when you cough and when you sneeze so that they're supporting your organs. So we can help with all of those different things. And the great news is that when I work with people with prolapse, we see lots of improvements in symptoms, which is amazing. There is something that you can do about it, and there are people that can help you. So to recap, you want to head to your doctor, get the referrals that you may or may not need, and then also see a pelvic physiotherapist who can help you optimize your muscle function. If you've explored both of those options and you're still not getting relief or improvement in your symptoms, there are a couple other next steps that you could take. So for some folks, a use of a pessary is possible. So a pessary is something that you would insert into your vagina if you're someone who has a vagina, and it can help support the organ that's prolapsing. That is something, depending on where you are, will depend on which type of professional can prescribe you with a pessary. So if you're curious about that option, you can definitely ask your doctor or your physiotherapist about it. And then usually the last resort or the last option would be a surgical intervention. So that's where you would actually get a surgery that would help support that organ more. Again, you're going to need referrals for that. And it is ideal if you try physiotherapy first before going to that level to see if optimizing your muscles resolves your symptoms. That's ideal. Then you can avoid surgery. However, if you need surgery, that's something that referral to a specialist will help you know. So you've got a team that can help support you with this. We really, really enjoy supporting you. We're happy to help you. So if you want to see one of us, you can visit the link in the bio to book with us. We see everyone online. And if you have any further questions, don't hesitate to write in the comments below. If you learned something, give us a thumbs up. And if you subscribe to our channel, you'll see more videos on pelvic health topics. All right, good luck with everything. I hope your symptoms improve soon.